National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopath and a health expert here at nationalnutrition.ca. One of the techniques that I often employ in my practice is traditional Chinese medicine, or the term I prefer is traditional Asian medicine, because what we find is that what we use as TCM, or traditional Chinese medicine, is often an incorporation of traditional Japanese, Korean, and other Asian cultures and their medicine. The reason we usually refer to it as traditional Chinese medicine in particular is because the Chinese culture probably had one of the earliest sort of recorded systems of medicine, where the early emperors would send out people into the rural villages to gather information about various medical practices, what was effective for what condition, and they basically did very, very extensive observational studies on medical practices, coming up with a medical system very, very early on in human history, and using very, very, in a way, scientific principles to develop an early system of medicine long before many other cultures were doing that, and definitely doing it in a way that very few cultures had organized to that level. And so this led to a great recorded history of medicine and a great observational history around the use of different types of medicine. Now, Asian medicine, it focuses a little bit differently on healthcare than Western medicine does. And the one thing that I really gravitate to with Chinese medicine or traditional Asian medicine is the idea of balance. Essentially, the key is that there's not, in Western medicine, we have X causes Y. So, the virus causes the cold. But in Chinese medicine, they focus more on how do X and Y interrelate. And the idea is that, yes, a virus is involved in the development of the cold, but just this, the single exposure to the virus doesn't automatically translate into a cold development. What Chinese medicine looks at is what imbalance in the body is creating a susceptibility in that person that they're going to develop a cold upon exposure to the virus. And so it brings into the idea of balance in your healthcare, that deficiency of things can be problematic just as excessive things can be problematic. And it's this principle that I find the most intriguing, and the one that I use the most in my practice, because it's focusing on how do we not just remove our body from disease, but how do we get it in its optimal balance so that it's functioning optimally. And that's what traditional Chinese medicine is all about. There's a variety of different ways that it can be practiced. And in fact, true traditional Chinese medicine incorporates lifestyle. It incorporates things like exercise and diet, and focuses those on the principle of essentially balancing the energies in your body. Other ways that we can we're often exposed to traditional Asian medicine or Chinese medicine is through techniques such as Shiatsu or Tui Na massage, acupuncture, and Asian herbs. Those are all more sort of like later things that a Chinese medicine practitioner would do. The real key and the real thing that I love about traditional Asian medicine approaches is focusing on lifestyle, creating a balanced lifestyle that restores and maintains health in the end user or in the patient. So I hope this helps you understand a little bit more where traditional Asian medicine comes from, and helps you have an understanding, and maybe hopefully you'll start to incorporate it into your healthcare plan so that you can achieve your optimal being. So if you like this video, please share it with others. You can always subscribe to our channel, where you can check out more of our health-related videos. Any questions or comments can be posted below, and always remember, knowledge is health.